Dear students, let us discuss about the Lumbricals. So what are Lumbricals? Before going to the discussion, I put a question to you. Think of it. What are the muscles of the hand and how are they divided? So the muscles of hand, they are divided into the intrinsic muscles and extrinsic muscles. What are intrinsic muscles? They take origin and get inserted and act on the hand, that is on the digits of the hand. Whereas the extrinsic muscles, they take origin away from the hand, that is either from the bones of the forearm or from the humerus, and they get inserted into the digits of the hand and the action is on the digits. So now you know what are intrinsic muscles and what are extrinsic muscles, the definition of these two groups. And let us discuss about the intrinsic muscles. So the intrinsic muscles, they can be divided into 5 groups and each group having 4 muscles. That is, there are 20 intrinsic muscles in the hand and all these muscles are on the palmar aspect. Then what are these 5 groups? They are divided into the thenar, hypothenar, then the lumbricals, the palmar interossei and dorsal interossei. Each of the group having 4 muscles. And in this session, we will be discussing about the lumbricals. And see the picture. The person is holding the ball in between his digits, between the thumb and the other digits. So, what is responsible for this movement? The word lumbrical is derived from the Latin, which means earthworm, because they resemble the roundworm Ascaris lumbricoides. That's why they are called lumbricals. So they are small worm like. You can see in this picture, you are seeing these 4 are the lumbrical muscles you are seeing in the palm of the hand. And then how they can be defined? They are the intrinsic muscles of hand and foot also. In the foot also you will see the intrinsic muscles. We are going to discuss the lumbricals of hand and foot together for making it more understandable to you. So the intrinsic muscles of hand or foot are the one that flex at the metacarpophalangeal or metatarsophalangeal joints and extend the interphalangeal joints. So they have a double action. So and opposite actions. So flexion at the metacarpophalangeal or metatarsophalangeal joints and extension at the interphalangeal joints. So metacarpophalangeal joints are in the hand and metatarsophalangeal joints are in the foot. Then these are 4 worm-like muscles in the palm of hand or sole of foot. So the lumbrical muscles of foot are of less clinical importance when compared to that of the hand. The lumbricals are different from other muscles. So what is the difference between these lumbricals and other muscles? So they are not attached to bone, whereas the other muscles, they are attached to the bones. Whereas these lumbricals, proximally they are attached to the long flexor tendons and distally they are attached to the extensor expansion, and both attachments are mobile. So proximally they are on the palmar aspect of the hand. So because long flexor tendons, they are on the palmar aspect. What are the long flexor tendons? It is the flexor digitorum, superficialis and profundus. but these lumbricals are attached to the flexor digitorum profundus. And distally they are attached to the extensor expansion. Where will you see the extensor expansion? You will find it on the dorsal aspect of the digits. So where they get attached. So both the attachments are mobile. That's why they have no bony attachment. And another point about the lumbricals is they are weak muscles when you compare it with the interossei muscles, as both of them they perform similar function. So the interossei are stronger than the lumbricals. And another point of importance is they have more number of muscle spindles. So the lumbricals have more number of muscle spindles. That means they are concerned with proprioceptive function. So how it will be helpful? It will help in the precise gripping of an object, like holding a pen or a painting brush, and precise manipulation of this pen or brush. So that is the advantage of these lumbricals. You are able to have a precision grip and precise manipulation because of the lumbricals. See the picture. So he is able to keep the fingers precisely. So he can hold a object. Let it be a rod or any other object where precision is important. Now let us see the lumbrical muscles in the hand and in the foot. So this is the picture of the palm dissection where you can see the small lumbrical muscles numbered 1, 2, 3 and 4 starting from the radial side to the ulnar side. So they are numbered. And the lumbricals, they take origin from the tendons of the flexor digitorum profundus, the lateral sides of the tendons for the index finger, middle finger, ring finger and little finger. From them they take origin. And if you see the sole of the foot, the lumbrical muscles, they are taking origin from the flexor digitorum longest tendon in the second layer of the sole. They take origin and they are numbered from medial to lateral 1, 2, 3, 4. That is the difference between the lumbricals in the palm and in the sole of the foot. And here the arrow is indicating the axis of movement which is different for the hand and for the foot. So the axis of movement for the hand is the middle finger, and whereas for the foot it is the second digit. So this is concerned with the movement of the interossei muscles, not with the lumbrical muscles, but it is shown here for making you understand. So if you compare the lumbricals of the hand and foot, then you will understand how to number them and what about their origin from these long flexor tendons and their attachment to the digits. Now let us discuss about the lumbrical muscles of the hand, as they are more important than the lumbrical muscles of the sole of the foot. So in this picture you are seeing the 4 lumbrical muscles that are arising from the 4 tendons of the flexor digitorum profundus. So you can see the long flexor tendons going to the terminal phalanx, and this is the radial side and this is the ulnar side, and you can see the lumbricals originating from the radial side, that is the first one and the second one, whereas the third one is arising from the tendons, that is the adjacent tendons, that is for the third and fourth and then fourth and fifth digits. And The first and second are unipinnate, and the third and fourth are the bipinnate muscles. Let us see their origins and insertion. So the first and second are having single head, and they are arising from the radial side of the flexor digitorum profundus tendons for the index and middle fingers, whereas the third and fourth, they are having two heads each. So arising from the contiguous sides of the tendons of flexor digitorum profundus for the middle and ring and little fingers. Then where are they getting inserted? As I told you already in the initial section, that they are on the palmar aspect and they are going towards the radial side of the base of proximal phalanx of second to fifth fingers and into the dorsal digital expansion, that is on the extensor aspect or dorsal aspect. Then what is their nerve supply? The first and second, they are supplied by the median nerve, whereas the third and fourth, they are supplied by the deep branch of ulnar nerve. So majority of the muscles in the palm, that is the intrinsic muscles of hand, they are supplied by the deep branch of ulnar nerve, excepting this two lumbricals. There is one exception. And then what are the actions of the lumbricals? As I already told you, they produce flexion at the metacarpophalangeal joint and extension at the interphalangeal joints of digits of insertion. That is the lateral 4 digits. It is producing the flexion at metacarpophalangeal and extension at the interphalangeal joints. So this is the action of the lumbrical. Okay. So flexion at the metacarpophalangeal and extension at the interphalangeal joint, and you can see the person is able to do the pincer action, able to hold a P in between the thumb and the index finger. So that is possible because of the lumbrical muscles. Oh, why there is opposite action of the lumbricals on the metacarpophalangeal joint and interphalangeal joint? As I already explained to you, these tendons are crossing from the palmar aspect. So they are going to the dorsal aspect. When they are going, they cross the metacarpophalangeal joints on the palmar side, but insert distally on the dorsal side of the finger. That's the reason why their action is opposite on the metacarpophalangeal and interphalangeal joints. And what is the advantage with this? It facilitates strong grip, like holding the pen or a painting brush. Then what is the clinical importance of the lumbricals of the hand? So these lumbricals will be crushed in injuries, crush injuries of the hand. They can get damaged. Because of the adhesion between the lumbricals and interossei, that is, they are getting adhered to one another distal to the transverse metacarpal ligament that connects the digits, which will limit the proximal movements of the both lumbricals and interossei. So the lumbricals are on the palmar aspect of palmar ligament, whereas the interossei are on the dorsal aspect of the palmar ligament. And during the crush injuries, they adhere to one another distal to the ligament, that is the transverse metacarpal ligament, limiting the proximal movements of both, that is the lumbricals and interossei. There is a clinical condition called lumbrical plus finger. See, if you have to hold a can, okay, a Coke can or whatever can which you are seeing in this picture, see the way one is able to hold. So all the 4 fingers, they are touching the can. So there is flexion at the metacarpopharyngeal and extension at the interpharyngeal joint. This is possible because of the intact lumbrical tendons. Detachment of tendons of flexor digitorum profundus, if they get detached distal to the point of origin of the lumbrical muscles, when it can happen after injuries or amputation. So the long flexor tendons of profundus, they get detached distal to the origin of the lumbricals. So when one is trying to close the fist, the fingers will extend instead of flexion. So if one is flexing the fingers, then they can hold that can. So if they are not getting flexed and if they are getting extended, the grip is not firm. So the lumbricals, they act as new insertion of flexor digitorum profundus. And activation of flexors, they will be moving the lumbricals. But the action of the flexor digitorum profundus on lumbricals are antagonists. So on the proximal and distal interpharyngeal joints. So instead of closing the fist, paradoxically it leads to extension of the fingers in this condition known as the lumbrical plus finger, and see the extension of the finger instead of getting flexed. See, these are flexed and this is extending. So because of the injury to the flexor digitorum profundus tendon distal to the origin of the lumbricals, that's why it is getting extended. So that is the explanation for the lumbrical plus finger. Now let us consider the lumbricals in the sole of the foot. Though clinically they are not important, you should learn about it. They are also concerned with certain movements. Let us discuss about that part. And they are originating from the tendon of the flexor digitorum longus for the lateral 4 toes. Okay. So you can see the 4 lumbricals numbered from medial to lateral, and they are located in the second layer of the sole of foot. So there are 4 layers in the sole of foot, and in the second layer you will see the lumbricals. So their origin is from the first to fourth. Let us see. The first lumbrical is taking origin from the medial side of the flexor digitorum longus tendon for the second two, whereas the second, third and fourth, they are arising from the contiguous sides of tendons of flexor digitorum longus for the second to fifth toes. Compare this with that of the palm. The lumbricals in the palm, first and second or single head of origin, whereas the third and fourth, they are having origin from the contiguous tendons. Whereas here only the first one is having a single slip of origin, whereas the other 3, they have got the dual slips of origin. Then where do they get inserted? So they are also getting inserted into the medial side of base of extensor expansion for the digits second to fifth, whereas in the palm they are on the lateral side. There is the difference between the two. Then coming to the nerve supply, the first one is supplied by the medial plantar nerve, second to fourth are by the lateral plantar nerve, whereas in the lumbricals of the palm, the distribution is equal. 2 from the median nerve, 2 from the deep branch of ulnar nerve. Then if you see, the action is the same as in the lumbricals of the palm. 2 different actions, that is flexion and adduction at the metatarsophalangeal joint and extension at the interphalangeal joints on the digit of insertion. That is their action. So the reason for opposite actions is same as that in the upper limb, because they are crossing the metatarsophalangeal joint on the sole side, getting inserted onto the dorsal side of the digits, and they are producing flexion and adduction at the metatarsophalangeal joint. So that is they are oppose the extension of long and short extensors of toes. They are opposing, and that's why they are preventing the hyperextension of the toes during the propulsive phase of gait. They are facilitating proper gait. That's what you have to understand. And then extension at the interphalangeal joint. That is, they are opposing the flexion by the long and short flexor tendons of the toes. That's why they are preventing the clawing of the digits during forward phase of gait. So that means the lumbricals are facilitating the proper propulsive gait in the lower limb. So now you have understood about the lumbricals both in the palm of the hand and sole of the foot.